بسم الله الرحمن الرحيم ونصلي على سيدنا محمد صلى الله عليه وسلم. Let's move to the next file, which is clinics. This is very important topic because it can show how exposed you are to difficult cases. Some of you are not well exposed in the clinics, but they can show they are exposed in the world. So how to do this later? Let's go. You do the first thing as we mentioned, a cover letter to refer, and in this you refer to the rotas to show involvement and frequency of clinics, because the general rota will show how many clinics you are doing per week, and it show how many patients, how many the frequency of of your exposure in the clinics. And this is very important. So next page, you need to include lists of patients you are seeing, but you need to redact the name and the details of patients, and you can leave it, the date of the clinic. For me, if you we use a system called eTrack, and we have lists of patients, we can print this, and then later on we can redact this file from details. For me as a consultant, I'm seeing from 10 to 13 patients, and usually registrars are covering 8 in Peterborough City Hospital. So if you include 2 or 3 lists, this will be good. I suggest, if you are a consultant, you can put 2. If you are a registrar, you can put 3 or 4 because the number makes some difference. Then the next page, you'll start including letters. You can put 10 or 20. It depends, I want you to show off. I want you to show off. Be showy, please. Include difficult cases of IBD. If I know that you are describing, prescribing biological therapy or starting and discussing biological therapy, I do not need to know that you are, prescribing mesalazine for simple cases, or giving steroid for a case, that has flare every 2 or 3 years. But if you are involved in IBD patients on biological therapy, you are adjusting, you are correcting, choose difficult cases to include in your portfolio. Show to the assessors that you are good and have good experience. And you need to include hepatology patients. I know not all of you are working in tertiary center, but you need to show that you are seeing general hepatology patients. You are reviewing cirrhotic patients. If you are not exposed to hepatitis B, you will see this in a different clinic under another hepatology colleague, and just involve yourself in, in few clinics with them, see a few cases with them, and prove that you have seen hepatitis B, hepatitis C patients. You can prove this from the ward. You need to also show that you have seen autoimmune hepatitis patients. If not in the clinic, then you can prove it in the ward or put it in interesting cases to show that you are exposed to different types of hepatology patients, and general gastro, like ulcer, like gastroparesis, like these different cases. But I would like to show off some cases towards the nutrition, like gastroparesis patients, like patients on peg tubes. While you are doing peg tube, if you can show off, this will tell us that you are exposed to nutrition part. Don't forget to put master score if you are doing nutrition case. Also, at the end, I want you not to forget to put a cover letter in the first page, and I want to give summary, of what you are doing to show your exposure. So you can say that I'm seeing general hepatology IBD patients and general gastro patients. There is no clinic specified for IBD, but we see a mixture of cases, and it differs from a clinic to clinic. If you are involved in IBD clinic, that's nice. Okay, it's good, but not all people have this exposure. Usually, it will be general containing IBD, containing hepatology, containing general gastro. So mixture of cases. Say to us, tell us that you are doing this, and we'll accept it. We'll accept it. So, in summary, cover letter To show that you are involved in the clinic since the beginning, you can refer this to rotas. I align that, please see the general rota to show involvement in clinics and frequency in the file called rota. And then you put few lists, 2 or 3 lists of patients to show that you are seeing 10, 8 patients per clinic. And then you put 10, 15, 20 cases uh, to show that you are exposed to IBD, hepatology, general gastro, nutrition cases. And then you can put a specific page saying that for other cases to show exposure to different parts of gastroenterology and hepatology, please go or refer to the Word file or the file called Word. Thank you.